Well, just like this never-ending winter, the flu seems to be showing no signs of easing anytime soon. Joining us now, Upstate Global Health Director Dr. Stephen Thomas. Always a pleasure to catch up with you. Thanks for joining us.
Yeah, thanks for having me, Jeff.
All right, bring us up to speed. How prevalent is the flu right now in central New York? On fire?
This has been a horrible, horrible flu season. I mean, nationally, we're looking at almost 30 million illnesses due to flu. Over 300,000 people have been hospitalized. About 16,000 people have died, including almost 70 children, which is horrible. So this has been an epic flu season, and central New York, although not as bad as some places, really has not been spared.
Anything you can draw? I mean, is this a particularly strong strain, or with the rough winter around here? Although you said it's really kind of across the country. I was going to say, are we inside more, or why do we think it's so high this year?
Yeah, that's an incredibly complicated question that a lot of scientists spend a lot of their time trying to figure out. There's so many different factors. You named some of them. So, one is how much time are people spending indoors, and therefore they're at risk of transmitting to one another. What are the vaccination rates? We know that they're lower than they've been in the past. The viruses, as far as we can tell, are the same as what has been, circulating, but that's still, put that in pencil, not in pen. We're not 100% sure about that. And then it matters what kind of flu seasons you've had previously, because they contribute to community level immunity and can impact what happens in subsequent years. So we're still trying to figure it all out, but there's no question this is a banner year.
I think people that aren't doctors like you automatically go when there are higher flu cases, and I know you said vaccination rates are lower, they automatically go to, well, the vaccine didn't match the strain that well this year. Do we have any evidence of that yet, or?
Yeah, I mean, so right now, if you look at the people who are coming with influenza-like illness to the hospital or to their outpatient physician and getting tested, about 1 in 5 or 1 in 4 are actually testing positive for flu. And, in comparison, it's about 1 in 10 that are testing positive or less than that for COVID. So it's really a predominant flu season. And for the first time since the pandemic started for COVID-19 back in 2020, flu has kind of overtaken COVID in terms of what is causing death due to respiratory illnesses. In the country. It is too early to tell. If the southern hemisphere, which has a different time sequence of flu, is any indication, we are going to be at about the 30 to 40% effectiveness range for the vaccine. But that just is the ability to prevent people from getting infected. That is not the ability to keep people out of the hospital, which is about 30 to 50%, and the ability to keep people out of the ICU or dying, which is around 60 to 40%. So for me, if a single dose vaccine can cut in half my potential of ending up in the hospital if I get infected, that's something I'm going to elect to do.
Yeah, I mean, I know we're into late February, and I know people that wanted to get it probably already have been vaccinated for the flu, but for those that may go, now's the time. Would you still recommend doing it, even though we're in late February?
I absolutely would, because, we see influenza up until June sometimes in central New York, and especially with the type of winter that we're having this year. I would seriously consider, especially if you're somebody at risk. So if you're over 65, I would consider it. If you have any issues with your heart, your lungs, or your kidneys, I would consider it. If you have any kind of immunosuppressed condition, so you have a cancer or you take medications for some other disease which can suppress your immune system, I would absolutely still consider doing it, because the flu vaccines last about, their maximum effect is about 4 to 5 months, so you're still within a window that you can get benefit.
Yeah. Last one, 30 seconds. Other usual things we say about illness: wash your hands, cover your mouth, stay home. I mean, those kinds of things to try to ward off the flu too.
Absolutely. Don't write it off as common cold. Don't write it off as allergies. If you develop any kind of respiratory symptoms, certainly fever, but a lot of people don't have fever. If you have runny nose or cough or shortness of breath or something like that, sore throat, I would definitely go to your local clinic or go to your primary care provider and get tested, because there are things that they can do to treat you.
Dr. Thomas, you know I always love chatting with you about this kind of information. Thanks so much for being here. We'll talk to you soon.
Thanks for having me.